Do I feel like the CDC guidelines were sufficient to ensure the health and safety of not only my mom, but all the nursing home residents at Riverside, as well as the staff? My answer is absolutely no.
Tonight, nursing homes across the country scrambling to increase safety protocols as healthcare experts warn that the elderly face the highest risk.
I just knew that if my mom contracted the virus, I didn't think that she had a good chance of making it. And so I just knew that I had to take action very, very quickly to make sure that her nursing home had all the proper procedures in place and had all the necessary support so the virus wouldn't just ravage the nursing home. When we got the call on the morning of April 8th, letting us know that there were 3 residents who had confirmed positive, that's when I sprung into action. Riverside knew the virus was spreading in the facility. They knew their residents were becoming infected and having to be isolated. And they still were not reaching out to us family members and being transparent with what was going on. I refused to be kept in the dark. I refused to sit on the sidelines and watch my mother potentially contract and die from the virus. As they kept on repeating to me over and over, we're following CDC guidelines, I said, well, maybe the CDC guidelines were working when the nursing home went on lockdown in mid-March, but they're clearly not working now in April, because if the CDC guidelines were working, then the virus wouldn't be in the building. The importance of the enforcement of safety standards is paramount. It has now been made very clear, not just in Texas, but the country at large, that any nursing home facility that has weak infection control procedures, that those facilities have seen the large outbreaks. I do not believe that nursing home facilities and nursing home companies should be given immunity, because mistakes were made in March and April and May in nursing homes, and the people who are entrusted with ensuring the health and safety of nursing home residents and staff need to be held accountable for those mistakes. Our federal government and our state governments have utterly failed our nursing home residents and staff in every state in this country. And I have to say, as a family member who has their mother in a nursing home that has just gone through a significant outbreak, it has been truly a national disgrace. I'm not going to stop my efforts about getting rapid testing machines into every nursing home in Texas, for the molecular point of care rapid testing machines to go inside every nursing home in Texas. The 4 things that a nursing home needs to fight the virus is ongoing, regular, rapid testing, adequate PPE, adequate staffing levels, and enforced infection control. If a nursing home is doing all 4 of those things, then they are significantly reducing their risk of having an outbreak. Speak up, be vocal, and make your public health and elected officials work for you and your loved one in the nursing home. Elected officials are here to work for us, not the other way around. Our public health officials are here to work for us, and we need to hold them accountable and make sure that they are doing their jobs, especially when it comes to nursing home residents who are at ground zero for this virus and who are the most vulnerable population in our society.